I think that that's somewhere where our data set is relatively unique. Is that I think not a huge number of centers have adopted single fraction SBRT. Something in other worlds, like, gamma knife for brain tumors, single fraction radiation has been around for a long time. Though likely that's because of the difficulty of attaching a frame to somebody's head and keeping it there for multiple days. With SBRT and the convenience of it, right? Multi-fraction regimen has typically been the standard. For central tumors, we definitely do not offer single fraction radiation, so it's only for peripheral tumors. But we participated in 2 randomized trials. One run by Roswell Park, also with the SUNY University system, and then another one run by the Radiation Therapy Oncology Group. Those are both relatively small trials with less than 100 patients. But they suggested equivalence for single fraction versus multi-fraction SBRT for stage 1 non-small cell lung cancer. A similar trial was done by Shankar Siva, on a group of patients with metastases, looking at, it also suggested equivalence for treating patients with lung metastases to single fraction versus 4 fraction, provided the peripherals provided the tumor was peripheral. So I think we have 3 small randomized trials, all under 100 patients, suggesting similar tumor control and quality of life and toxicity profiles. I think when the prospective data sets are so small, then the retrospective data, becomes more important to feel comfortable that there's enough volume there to suggest that. And I think our data set, has hundreds of patients with, it has greater than 10-year follow-up. Certainly for us, as long as we restrict to peripheral tumors, right, we cannot find any difference in tumor control or toxicity for single versus multi-fraction. In fact, as we talked about in the first part of the discussion, for those squamous cell carcinoma patients, single fraction, appears that it may even be more effective than the relatively lower biological equivalent dose, the 4 and 5 fraction, 48 and 4 or 50 and 5. May not be quite adequate BED versus the single fraction gets closer to that biological equivalent dose that's given for the 3 fraction patients. Yeah. So we're certainly very comfortable with that for anyone with a small peripheral tumor.